Arlington Public News wants to offer a retrospective on the country that hosted the World Cup 4 years ago, South Africa. Today, we are talking with Mary Tiseo, Executive Director at South Africa Partners.
Hi, I'm Yawa Degboe with Arlington Public News. Most of the people who care about soccer watch the World Cup hosted in Brazil. Arlington Public News wants to offer the retrospective on the country that hosted the World Cup 4 years ago, South Africa. Today, I'm with Mary Tiseo, Executive Director at South Africa Partners, a Boston-based non-profit organization that builds mutual beneficial partnership between the United States and South Africa in the area of health and education. Good afternoon, Mary. Thanks for being here.
Happy to be here. Thank you.
Great. I've read one of a very old post on worldcupboston2010.org regarding the World Cup in South Africa. And you said, I quote, "This is their chance to exert some influence over how their national narrative is constructed. It will not only be violence, poverty, and AIDS, but also innovation, determination, and success that are projected to the world." So 4 years later, South Africa spent like $3.9 billion on the World Cup. What were the expectations, and did they realize it?
Well, I think that it was an enormous amount of money, and you'll still find people in South Africa who will say that money could have been spent in better ways. But when I've been going, I go 3 or 4 times a year to South Africa for work. I can see that the tourism that the World Cup generated 4 years ago has continued, so that South Africa is a destination place for many people in Europe and South America, the United States, Asia. And the World Cup had a lot to do with that. It helped to introduce new groups to South Africa.
Do you believe South Africa is now facing different challenges? Do you believe that this money could have been used to resolve those different challenges? And maybe you can talk about that a little bit more?
Well, I don't think I can really address sort of whether the government's program was successful. I don't know the answer to that. But I do know that in many places there is new housing that was a result of the World Cup. There are many more people who were trained in the tourism industry because of the World Cup. And I think that for the government and foreign relations, it was quite successful for the country.
So right now the employment rate is 24.1%. And if we look specifically at the range 15 to 24 years old, the employment rate is 52%, according to the International Labour Organization. What's, in your opinion, what factor created such situation, and what could we do to resolve it?
South Africa, like many developing countries, has the economic crisis that started in the United States and spread to Europe and to Asia has affected the rest of the world. And while we can see that there are improvements here in the United States, the unemployment rate, the national unemployment rate went down to 6.1% recently. That's a huge accomplishment over 5, 6, 7 years, 8 years of concerted effort on the part of the United States. I think that countries like South Africa whose economies are tied to the global economy have suffered quite a lot because of the economic situation in our own country. But at the same time, South Africa also has enormous challenges around education. I would say, in talking to people in South Africa and from our own experience working there, that's probably the biggest challenge that South Africa has right now. I mean, I know people know about the AIDS crisis and the AIDS epidemic, and not to take away from that, it is a huge burden on the country. South Africa has more people on antiretrovirals than any other country in the world. I mean, in many ways, the global health community is looking at South Africa and how it's managing this disease as an example for other countries around the world about how they can handle their AIDS epidemic. But all of the work that's been done and the gains that have been made in the transformation of the healthcare system in South Africa have been an enormous boost to the country. But there aren't, in the education system, that same level of transformation has not happened. And I think it's important for people to remember that when the National Party came into power in 1948, one of the first things that it did was to dismantle the education system for Black South Africans. And that was done very purposely. They understood that in order to control the majority population, they had to ensure that they weren't educated, or that they would only be educated to the level of serving the white population. And so they instituted a policy which was known as Bantu education. And they systematically took apart, dismantled the Black education system, so that you had, there was no math and science that was taught in the Black schools. And teachers who taught in those schools were not taught those subjects either. And that has had a devastating effect, I think, on the education system of South Africa. I mean, you can see the difference in, there's a great deal of African migration into South Africa for economic reasons, very much like the United States. People are coming in from Central and South America looking for opportunities in the United States. Well, South Africa is kind of the magnet for Africa. There are immigrants that are coming for political reasons, for economic reasons. There's a whole range of issues why they're coming into South Africa, but they see it as a place where they could maybe rebuild a life and have a better life. Even though people are coming from countries where there are severe economic challenges, the education system that people grew up with, even if they were poor in other African countries, exceeds the education system that South Africa has. And so people are coming in with higher level skills, reading, mathematics, writing skills, that are critical to any economic system. And so some of the tension that exists in South Africa around immigration is really about that, is that they're competing with people who are new to the country, but whose skills are higher than theirs. And that's a tragic situation, and there you can trace it back to the policies of the apartheid government. But transforming that system is a huge challenge. I mean, HIV/AIDS in a bizarre way forced the transformation of the healthcare system. It forced that money came in from all over the world to make sure that the AIDS epidemic was addressed. And in the process, people were trained, systems were transformed, and you have a higher functioning healthcare system as a result. The education system hasn't had that benefit. I mean, if you call it a benefit.
Okay, yeah. And let's talk about your organization, South Africa Partners. What do you do to address this situation? I would say in education, but also healthcare.
Well, first of all, we incorporated in 1997, started working in 1998, but we had grown out of the anti-apartheid movement. So there were 4 of us, 3 other women and myself, who started South Africa Partners. And it was really about understanding that the Nelson Mandela's release from prison and the unbanning of the African National Congress and the other political organizations and the striking apartheid laws off the books didn't mean that suddenly South Africa was going to be a free and democratic country and able to take care of all of its people. And we understood that it was 350 years of legislated and policy-driven segregation and putting down of the black population, and to suddenly now say that Mandela's president, it's all fine, we can move on to a new issue. We just felt like that was, it was going to take a few more years than that, and we wanted to keep people engaged. We felt like there are enough similarities between the United States and South Africa and our racial and political history that we share. I mean, it's different. It's a different country, different people, happened at different times. But one can see the similarities between the two countries. And we felt like we had a lot to learn from South Africa. And at the same time, we could maybe help to address the legacy of apartheid by helping to transfer skills, build local capacity that would allow South Africans to actually do the work that was necessary in order to transform the country.
Could you give me a specific example of project you're working with in education, but also healthcare? Yeah,
I think with healthcare it's a little bit easier because we've been doing that longer. So in 1997, the state of Massachusetts and the province of the Eastern Cape, which is one of the 9 provinces of South Africa, signed a sister state province agreement. So it's an agreement that we're going to cooperate. The state and the province are going to look at opportunities to work together. So we use that agreement, that government-to-government agreement, as kind of an umbrella for the work that we started to do. And our first success was in partnering the Massachusetts Department of Public Health with the Eastern Cape Department of Health. And it was just as the AIDS epidemic was starting to hit in South Africa in 2000, 1999, 2000. And so very quickly we understood that there were some opportunities to learn from the Massachusetts example so that South Africa didn't have to reinvent the wheel. It could look at interventions that Massachusetts had developed over the 10 years prior, because the epidemic hit here earlier, and take some examples, some programs, adapt them rather than starting from scratch. So the head of the HIV/AIDS department from the Eastern Cape came to Massachusetts, and she identified a couple of interventions that she really wanted transferred and adapted to the South African experience. And out of that work, Massachusetts has a kind of unique approach, actually, even in the United States. It's quite unique, in that people living with HIV are actually advisors to the state government around programs for people living with HIV, so that you know that the services are actually appropriate, they function the right way, there are people monitoring whether the services are actually being delivered properly. And so that was what she was looking for. She wanted to develop a network of people living with HIV that would work hand in hand with government to start designing programs that would deliver services at the local level. So that work started in earnest in 2004. We were able to hold our first conference in the Eastern Cape. And from there, we slowly developed a cadre of people living with HIV that worked with us and with government. And we identified a gap in service delivery. By that time, the government was delivering antiretrovirals, so if you came in, you got tested, you were ready to go on medication, there was a protocol for you. You went to, talk to this person, you got on medication, you came back for services. It was all very well scripted. But for people who tested positively for HIV and were not yet ready for antiretrovirals, there were no services for those people. And unfortunately, that's a pretty devastating, as you can imagine, a pretty devastating diagnosis. And yet there was no support for people. They were just told, well, you're HIV positive, come back in 6 months, we'll check your CD4 count, and we'll let you know how you're doing. And so we quickly worked with some people living with HIV to develop a support group system for those newly diagnosed, which over time has become what is known as the Integrated Access to Care and Treatment Program, the IACT program. So that is something that happened in the Eastern Cape, but it's now in all 9 provinces. It's been adopted by the National Department of Health as a best practice, and we are working with the National Department of Health to integrate it into the healthcare system. So that's an example of taking an innovation from Massachusetts that was identified by our colleagues in South Africa, working with the South Africans to adapt it and make it really a South African program, and with the help of the Eastern Cape, getting it into the national system. So we're quite proud of that.
That's a success story.
Yes, it was a terrific success story. And we're not done yet. You know, it's not fully integrated into the healthcare system. So we have another 18 months at least to do that work. And we hope maybe a little bit longer than that too.
Mary, what would you recommend to anyone who wants to get involved?
They can go to our website, South Africa Partners, www.sapartners.org. And we'd be happy to talk with them and give them some ideas.
Mary, thank you so much for coming.
My pleasure.
I'm Yawa Degboe with Arlington Public News. Thank you for watching.